It's a real pleasure to catch up with you, Dr. Shamanna, here at the India Vision Institute. Dr. Shamanna is a faculty at the University of Hyderabad in the School of Medical Sciences. Now, Dr. Shamanna, you have been a person who has spent a couple of decades playing with numbers, especially when it comes to eye health. Now, over the last 2 decades, what are the really worrying trends you've seen, based on the significant amount of data that you've looked at?
Foremost, I want to thank you, Vinod, and the India Vision Institute for having me here. As you said, I've been looking at the numbers very closely when it comes to eye health and eye care. What's happened over the last 2 decades is both the cause for, it's something which is good, and at the same time it throws up very important challenges for us. What has happened over the last 2 decades is we've seen that there's definitely a reduction in the burden of cataract blindness. But that doesn't mean that cataract as an issue which could become, where people could become blind in future, has reduced. But what has happened is the number of surgeries have improved tremendously, from something like 1 million in 1990 to currently about 6 million plus within this country.
So you're referring just to the cataracts?
I'm just referring to the cataract. What is worrying, and especially worrying when I speak in a platform provided by the India Vision Institute, is the number of people being blind due to something called as uncorrected refractive error has increased. And you can say that this is part of the reason because of what we call as epidemiological fallacy, in the sense it's because we look for it, we find it. But what has happened basically with uncorrected refractive errors emerging as an important cause of blindness is due to pressure from developing countries, and especially countries from South Asia like India, Nepal, Bangladesh, etc., on the World Health Organization. The World Health Organization sort of relaxed the definition of blindness and visual impairment from what is called as best corrected vision definition to presenting vision definition.
Right.
When you use a definition which is presenting vision as opposed to best corrected vision, it suddenly throws up a number of refractive error cases being blind. And I think it's a disgrace when we have 20% of our blindness due to something as simple as, when I say as simple, it is about simple to recognize, simple to correct, and getting the best results with a reasonable amount of money, which is the uncorrected refractive error. So,
and you're saying this great increase in number is because of the change in definition.
One is the change in definition.
So the numbers were always there, but now it's reflected in the data because of that.
Precisely.
Yeah. Now, coming back to what you had said about the positive aspect with regard to cataracts, what were the main reasons why that's an issue that is being handled a bit better?
The reason is, I think, one is we've always judged our program based on the performance related to cataract surgery.
Right.
If you look at the national program, one of the indicators to say that the program has done reasonably well over the years is because the number of surgeries, and especially measured in terms of number of cataract surgeries, have gone up.
Is it because there's more funding or because more people are aware?
It's also because of more funding. It's also because of the techniques of surgery which have, I think it's also because of the decentralization of the program, which happened. So we came to a point in the early 1990s or the late 80s where we had a watershed point with respect to our eye care program. That was when we stagnated at about 1.5 million surgeries. And suddenly we realized that if we only change our strategy, then I think the numbers would increase. And one of the reasons for that was to decentralize our eye care program to the district level, with the understanding that people of the districts know the district well, and it provides a platform. So the devolution of funding, devolution of power, devolution of organization from the central level became decentralized to a district level. And people of the district, with the district collector being the chairman of a society called as the District Blindness Control Society, took charge. And suddenly you see a spurt in numbers. And the shot in the arm was because of a large tranche of funding which came from the World Bank program.
Right, right.
The World Bank, for the first time in its history, supported an eye care program, and that happened in India. So between 1994 and 2001, 7 states in our country were supported for 7 years to perform X number of surgeries and set up so many facilities. Right. And that was a shot in the arm, and that's probably the reason you see today that the proportion of blindness due to cataracts has gone down, but you have emerging problems like I said, uncorrected refractive errors.
So, but maybe just taking that discussion a bit further, if you want to see a similar trend in uncorrected refractive error, what would you suggest we should do nationally?
I guess we need to prioritize uncorrected refractive error as equivalent to our program related to cataract.
Right.
I think at this point in time, the only priority for the national program seems to be doing more number of school vision testing programs or school eye screening programs, or doing correction after surgery. That seems to be the only sort of thing. We have not recognized that presbyopia or issues related to near vision is a problem which doesn't blind people, but which actually can impact people's life in terms of low socioeconomic productivity. So I'm looking at least 80% of our population above 40 years requiring some sort of correction. So you have the numbers. I guess you also have the modalities of management. Yeah. You need the people, and I think that is where an organization like the India Vision Institute can make a huge difference in terms of training adequate human resources, building their capacities, making sure that you can develop systems in order to reach the unreached or the lowest common denominator. I see that it is perfectly within our reach. We need to have some sort of shared prioritization and shared vision with respect to surmounting this problem.
Thank you so much, Dr. Shamanna, for your time and catching up with us.
Thank you very much, Vinod. Thanks. Thank you, guys.